Hello, my name is Anthony Almeida. I'm an emergency physician at Jamaica Hospital Medical Center. As part of our How-To series, I'm going to be discussing how to treat an ankle injury. Ankle injuries come in many varieties. Today, we're going to be discussing sprains and fractures. Sometimes it can be very difficult to tell what type of injury you have. If you ever have an ankle injury and you have severe pain in your ankle or in your foot, if you're unable to walk, if you have any significant deformity or swelling, if you have any numbness in your foot or are unable to wiggle your toes, these are all signs that you may have a broken bone or an ankle fracture, and are all indications that you should see a physician and possibly receive x-rays as soon as possible. We typically treat more mild ankle injuries such as sprains with something called RICE. It stands for rest, ice, compression, and elevation. Today we're going to be discussing how to actually apply an ankle compression dressing. We're going to start by pointing the toes up towards the ceiling. We're going to take our compression wrap. This particular type has a piece of Velcro that holds it together. Other varieties have metal clips. We're going to aim the Velcro part facing up along the middle of the foot with a roll facing outward. We're going to start to compress the foot, and as we move along the foot, we're going to continue to wrap up around the ankle and make figure of eights down along the foot and back up towards the ankle. At no point should you notice discoloration of the toes or swelling. These are all signs that the wrap itself is too tight and should be loosened. Ideally, you would like the Velcro to extend up to an area that isn't going to be in contact with the shoe, because this can cause discomfort. And that's how to wrap an ankle. I hope you found that helpful. If at any point your symptoms do not improve, or you would like to be evaluated by one of our physicians, we're always here for you at Jamaica Hospital Medical Center. I'm Dr. Anthony Almeida.